I'm so happy that we did it to
Oh
arrange this
yeah,
interview.
we've
And
been trying to on and off.
yeah, and we're gonna start on this part, Ken, because the latest developments in technology no longer surprise many of us, especially in the field of medicine, knowing that most surgery and medical services can be performed with the help of robots. However, is it still interesting to know from healthcare professionals' perspective what it is like to use robots in certain operation? I'm so happy that you're going to give us much more information about this topic because you are the one person who made a lot of surgery with robotic.
So just so you know, my name's Ken Chang, and I'm excited to kind of talk to you, and hopefully your audience can kind of learn a little bit more about robotic surgery. I'm a practicing general surgeon. I live in Irvine, and I work at Kaiser Riverside, and I do a lot of robotic surgery. It's kind of a big part of my practice now, and I've been doing robotic surgery for about 10 years, so it's pretty
Wow.
exciting for me to be able to kind of tell you guys a little bit more about like what we do and stuff. Yeah.
Mhm. Could you tell us about how robotic surgery has transformed the field of surgery?
Yeah. So it's interesting because, the question is, when you talk about surgery and the progress of surgery, it's always been kind of like little small developments, incremental along the way. There have been generally some great leaps that have happened along the way too,
Mhm.
right? So, about like probably, I'd say probably it was about 40, maybe 50 years ago, 40 years ago in the 80s, right? When we made one big leap, and that was going from open surgery, which, is very intuitive. Open surgery is when you take a knife, you cut something open, you do what you need to do inside, you close it back up, right?
Mhm.
And we made a big leap in the 80s to going into what we call laparoscopic surgery. And that's basically saying, oh, we're not going to cut you open anymore. We're going to make little tiny holes, put little chopsticks inside. I always tell my patients I'm really good at it because I'm Asian. I'm good with chopsticks. And so we use little chopsticks inside you and a little camera, and then we can do what we need on the inside, and then we just close up little holes. And that was like one of the big, big leaps in surgery back in the 80s.
Mhm.
Yeah. And that was really, really scary for a lot of surgeons back then, right? Because, if you were an open surgeon, you trained doing open surgery, right? And then these people come along and say, no, no, we're not going to do it that way anymore. We're going to use tiny little holes, these cameras inside. And the open surgeon says, I don't even know how to do that. I've never done that before. And so it was a big challenge to move from that,
Mhm.
right?
Can you
And
tell me your first experience when you started to do surgery with robots?
yes.
Um,
So the thing about it is robotic surgery is another step, right?
mhm.
And so that's what we call laparoscopic surgery. And then we moved on, and there was a lot of limitations with laparoscopic surgery though, because like I said, you're using chopsticks. And if you think about it, you're using chopsticks, you can't really, once you put your chopsticks inside of someone's abdomen, you can't really move, right? Because they're
Mhm.
chopsticks, they're straight, right? And so you can't really do the things. And so I always felt that like even though I trained doing laparoscopic surgery, right? Because I've been in practice for over 20 years now, 20 some years now. And I always felt like, oh man, that really prevents me from doing all the things I need to do. And then furthermore, you're watching things on a television screen, right? And you don't really get 3D vision. And there's a big difference between 3D vision and 2D vision. And so my first experience, you're asking about my first experience with robotic surgery, right? Was realizing, oh my gosh, I can't do this. But the robot, when you use a robotic surgery, you're able to overcome that limitation, right? Because the robot is basically allows you as a surgeon to overcome the limitations that you had when you had laparoscopic surgery and allows you to do things that you weren't able to do laparoscopically. And so that was the eye-opening experience of doing a robotic surgery. And so it was definitely a good experience. But I think that it's probably useful for your audience to kind of. I think there's probably a lot of questions about like, oh my gosh, robotic surgery is the robot going to operate on me? Where's the surgeon going to be? Is he on a coffee break or something like that, right?
What you are
Or
doing in that moment when
like,
the
oh,
robot doing your job.
Yeah, no, because a lot of people think like, oh, robotic surgery, does that mean that a robot's going to do surgery? I actually have a little cartoon. I can show you. I can share a screen right here. Let me see if I can show you
Yeah.
this. What is robotic
Oh,
surgery, right?
yeah. Yeah.
And then it says there's a mini series from a long time ago where it says with danger, Will Robinson, danger from Lost
Mhm.
in Space, right? And then you have a patient there saying, oh, remind me again, how is robotic surgery safe? Right? And so the idea is that like people look at this and they think, oh my gosh, is the robot doing the surgery and is the surgeon not really involved? And I
Mhm.
think you can make it clear that that's actually not the situation,
Yeah.
right?
Yeah.
In robotic surgery, the robot is more of a tool, you know.
Mhm.
I am not actually, the robot is actually doing nothing. The robot is as if it was a scalpel.
Yeah.
And so it's like a scalpel or a blade or a hemostat. It's something that I actually control the entire time. And
Mhm.
so in robotic surgery, what it involves is a way to do minimally invasive surgery with more tools that you could before. And so the parts of a robotic surgery, right, kind of look like this. So
Okay.
this, right, is the picture of what a typical robotic surgery setup looks like, right? And
Mhm.
so as you can see, there's this robot thing with all the arms. It kind of looks like a spider, right?
Mhm.
And that basically is at the patient's bedside, right? So the patient is lying on the table, right?
Yeah.
And we cover them up to keep it all sterile. And me as a surgeon, right? I as a surgeon would be sitting here at the console, right?
Mhm.
And then over here is a computer, right? And so everything I do goes into the computer and then gets
Yeah.
translated to the robot. And
Mhm.
everything the robot sees with the camera goes to the computer and then gets projected to my console here. And so it's very much like playing a video game, except, the stakes are a little bit higher. So, yeah.
So we have some advantages, a lot of advantages today of using robotic system in surgery compared to traditional methods, right?
Yeah. Yeah, for sure. I mean, the main thing that I am now able to do, and the thing that I do the most, right, is a lot, and is advances in hernia surgery, right? And
Mhm.
so one of the things that or it's more like what I specialize in, and what it's allowed me to do is provide basically the equivalent surgery that you would have done in an open operation,
Mhm.
gold standard type operation, without compromising anything, but allowing it to be done through small incisions. And so previously, you can attempt to try to do it through small incisions, but it would have taken, 6, 8 hours to do it. And now we can do it with a robotic surgery. We can do it in like 2 to 3 hours, which is a big advance, right? And furthermore, helps people recover faster from the hospital, gets them out of the hospital faster. People need less pain medication. They get back to work earlier, and it's a big advantage in that sense.
Mhm.
And so, yeah.
While we are talking about advantages, do we have a challenges? For sure, you have a challenges doing the or using robotic system in
Yeah,
surgery.
yeah. Challenges come in different forms and fashion, right? There are technical challenges, meaning that, challenges in terms of just the operation itself, right? Some of those are kind of, a little esoteric, right?
Mm-hmm.
It's not something that, I think your audience would be able to appreciate, right? But the other challenges include dealing with misperceptions, right? So sometimes when I mention that to a patient that, oh, we're going to do robot surgery, kind of the misconceptions that they get, they say, well, if the robot's doing it, what are you going to do, right?
Mm-hmm.
And then the other challenge is making sure that you are up to date, right? And so
Yeah.
one of the big challenges as an overall, so the challenge is not just the surgery itself, right?
Mm-hmm.
But the challenge is also acquiring new knowledge, right? Because
Yeah.
I've been out of practice I've been in private practice now for almost 20 years.
Mm.
When I first came out of private practice, there was no robotic surgery,
Yeah.
right? So in my training, I didn't know anything about robotic surgery
Yeah.
because nobody was doing robotic surgery,
Yeah.
right?
Right.
And so, and that's a big challenge when and then you discover that there's this new technology out there.
Mm-hmm.
Intuitively, tend to think, well, this technology should be useful, right?
Yeah.
It makes sense, right?
Mm-hmm.
Um, and then you say, oh, well, yeah, I want to try to do it, right? But that's a big challenge, right? Because you've not been trained. The challenge of my career, right, is making sure that I am able to offer the best to all my patients,
Mm-hmm.
right? Staying up to date on the most recent techniques, right? But not overdoing it and stretching myself beyond what I can do, right? And staying safe. Because when you're learning a new procedure, or you're learning a new technique, or you're learning a new tool, right? It has to be incremental, right? And you have to do it safely, and you have to do a lot
Yeah.
of training. And so adopting robotic surgery in the surgical community has always adopting any new technology in any surgical community has always been a little challenging because there will always be people who are kind of wary of that change, right?
Mm-hmm.
And there will be administrators, and there will be people who, in their best intentions, are trying to safeguard patients, right? Are going to be resistant to say, oh,
Yeah.
well, do we really want to try something new when it's worked okay so far? And so
Mm-hmm.
the mentality becomes, well, if it's not broke, if you can fix a hernia this way, why not keep doing it that way, right? Not
Yeah.
realizing that on the other side of that, right? If you're willing to put in the work and be careful, right? And it learn incrementally, there is a way to do things better, right? And
Yeah.
so I think one of the big challenges is
Mm-hmm.
acquiring new surgical skills after you've been out of practice,
Yeah.
because surgeons can't really just say, "Oh, there's something new. I'm going to take like a month, like 3 months off to go learn this thing," right?
Mm-hmm.
Um, because I have a family to feed, and so that is a challenge in general.
Mm-hmm.
And the other challenge is also um, uh, making sure that your enthusiasm for new. So one thing is trying to get past that barrier of having the willpower to learn something new,
Mm-hmm.
but then also having the recognition of your limits, and not just my limits, but of my peers. Right? We all, as physicians, we all kind of have to look out for each other, right, and make sure that we are doing the right things, doing the safe things, and make sure I listen to my peers when my peers tell me, when my colleagues tell me, maybe we should slow down on this a little bit, look at it a little bit closer before we move forward. That's something that we have to be conscious of as well.
Mm-hmm. How long does it take to you, especially uh, practicing or training doing robotic surgery?
So historically, remember I told you earlier about the great leap in surgery, right? Great leap from open surgery to laparoscopy. When that leap happened from open surgery to laparoscopy, a lot of doctors jumped in very quickly.
Mm-hmm.
Why? Because it is such a big difference when you have an incision and you have small holes. But when they jumped in that quickly, we went back and we looked at some of the early data from laparoscopy, right? And we could see that there were more incidences of mishaps, common duct injuries, basically specific injuries to certain structures that happened more often when you did those small incisions than when you did the open incision. Do you see what I'm saying? And so we learn from that experience, right? Now, that's not to say laparoscopy is not safe. Laparoscopy is
Yeah.
very safe now,
Yeah.
right? Because now we're much better trained and much more attuned to how to prevent those things. And also, the surgeons today are actually better trained in laparoscopy than they are in open surgery because that's what we do the most. Okay.
Mhm.
Now, robotic surgery is kind of in that same boat right now, right?
Okay.
It is very exciting. It's starting out, right? Benefit is not quite as big of a jump as it was from open surgery to laparoscopy, right?
Mhm.
And so it's a little bit slower in and so the run into the technology is not as dramatic as it was during laparoscopy. But we learn from that experience, right? we learned that, we have to be very careful. We have to monitor our results, right? And so um, Intuitive, right, who is the
Mm-hmm.
company that basically makes the robots, right, has pretty strict criteria about how much training you have to have before you actually start doing
Okay.
cases, right?
Mm-hmm.
And so that includes going to, I think I don't remember how long it was because it was such a long time ago when I first started doing this, right? But usually there's a training session, right? Which includes lectures and hands-on models, including not a cadaver lab, but a pig lab where you use, anesthetized pigs to practice the techniques, right?
Mm-hmm.
But even then, people are not. So that's usually like kind of like a week-long course, 3 or 4 days a course when you do that, right? But then they don't send you out and start operating on people right away. We usually then, I remember back then, we also did a bunch of proctored cases. And so up to basically going around to other surgeons, watching them do their operations, picking their minds, understanding what the problems, the pitfalls, right? The Intuitive company also wants to train their team, train the teams you work with to make sure that everybody who's working with you knows how to use the machine as well, right?
Yeah. Yeah.
All in all, it's one of those things where, um, despite all that, right, are there times when people are not adequately trained and maybe the use of the robot results in, mishaps? Of
Mm-hmm.
course, that can happen, right? But the good news is that we monitor that all very closely, right? And we try to make sure that, people are trained appropriately and that we watch each other. Now, one good thing about working at a large organization like Kaiser, right, is that when you're at Kaiser, there's so many other surgeons who are resources for you, right, that can support you, who will proctor you, who will make sure that you have assistance in all of your cases to make sure that
Mm-hmm.
things are going smoothly. And so that's one of the good things about robotic surgery.
Yeah. Uh, During this interview, during our conversation, you mentioned a little bit about misconception. Can you
Yeah.
tell me some common misconceptions about robotic surgery that you'd like to address now?
Common misconceptions. Well, I think the most common one, right, is just the mystery, right? Is just like the idea that it's a robot doing surgery, right? And so I think it's a little bit of a misnomer, right? Because in a way, people think of a robot as, a robotic machine that thinks on its own,
It's
right?
kind of scary, to be honest.
Yes. Somebody says robot, you think, oh, Arnold Schwarzenegger in Terminator or something,
Mm,
something that's autonomous and able to move on its own. And the biggest misconception is that, right? And really, we shouldn't really call it robotic surgery. In
mhm,
reality, we should call it machine surgery, right? It's a machine that I control. It's like it's a bulldozer, right? And so like or a tractor or a crane, right? So it's a crane that I operate, right?
mhm,
I think that's the biggest misconception. The second misconception, which might sound a little strange, right, is people thinking that robotic surgery is inherently so much better. Okay,
mhm,
all right, it is not necessarily so much better. Okay, because in certain situations, it definitely makes a big difference. Okay, in certain situations, it allows you to do things that you weren't able to do before. But in many situations, a lot of the operations, the laparoscopic technique is just as good, and in some ways, much better, cheaper, and perhaps more effective than the robot. And so I think some people will go to their surgeon saying, I want to have my surgery done robotically. Like some people, maybe even some people who listen to this podcast who will be inspired, oh my gosh, I should never have regular surgery again. No, that's not true. You
mhm,
know, most operations, and particularly and especially, I think the most important thing for a patient when they see their doctor is not how the doctor does the operation, right? It's how much you trust that doctor and whether that doctor is a good doctor, right?
mhm,
Because that doctor, right, knows how to do the things he knows how to do. You should never convince your doctor to do something that he's not comfortable doing. Does that make sense? And so, there's a lot of talk these days about doing, laparoscopic gallbladder surgery, laparoscopic this surgery, laparoscopic this, or robotic this surgery, robotic that surgery, right? And, if your doctor is telling you, no, I don't think that's a good idea, right?
Mhm.
I think we should do it this way, right? Do it the way he wants to do it,
Yeah.
because he's going to do the best job that way. That is a misconception. Like some people, even though here I am a big enthusiastic endorser of the robotic platform, I don't think it's a cure-all. I do think it's a little more, it's definitely more expensive, right?
Mhm.
And it may not be better in many situations. And I think that's a different type of misconception that's out there as well.
Dr. Khan, do you see robotic surgery becoming standard method in the future?
It's a good question. You know, I think there are going to be, perhaps in America, all right, it may become much more standard. The thing that makes it likely to become more standard, ironically, right,
Mhm.
to me, is not so much the technology itself, but potentially the generation of surgeons
Mhm.
coming after me, right? Because there is a cohort of surgeons now, right, who start learning robotics earlier on.
Yeah.
And when they come out, they may not be comfortable not doing robotics, right?
Yes.
And so
Yes.
as that cohort of surgeons increases, right, the demand for robotic surgery will increase not from patients necessarily, but from those surgeons going to hospitals. And in the sense, that could be a good thing, right? Because, it will make the robotic surgery more available, right? But I think that it could also be not such a great thing because currently robotic surgery is definitely still more expensive than traditional
Yeah.
laparoscopic. If robotic surgery becomes more standard across the board, right? So that current procedures that are not done robotic, they've done laparoscopic, converted to robotics, right? Then it's possible that as that progresses, the cost of robotic surgery can come down so that it becomes more parity.
Just from your experience, can you
Yeah.
share why robotic surgery made a significant difference in the outcome of patients' recovery?
I would say there are two big things. Okay, in the field that I operate in, right, and I'm a
Mhm.
hernia specialist, so I take care of a lot of hernias. For your listeners who don't really know or your audience that doesn't know what a hernia is a defect in your abdominal wall, the muscle layers of your abdomen of your belly, and if you have a defect in that muscle layer, your intestines can kind of sneak through, right?
Mhm.
And traditionally, our approach to fixing that is to basically cut on top of that, push your intestines back in, and reinforce it. Um, I think that the robotic platform has allowed me to fix these hernias in such
Mhm.
a way that's superior to both the old open technique and the laparoscopic technique. And the biggest benefit that I've seen for the patients, right,
Mhm.
is early recovery, meaning that they leave the hospital the same day after as a surgery. Almost 95% of my patients, even if they have a very large hernia, right, they can still have go home the same day. And in the past, they would have to have a large incision. They'd have to be in the hospital for 2 to 3 days, if only for pain control, taking so much narcotics that their intestines kind of slow down and they get an ileus, right? And then they get bloated and it's very uncomfortable. Sometimes you get nausea and vomiting. And so with the robotic platform, we can avoid all of that. And the other main advantage that I see from my patients is wound complications. And that has always been one of the biggest problems with hernia surgery. We are fixing your hernia, we have to put a piece of mesh in, and then we close up your skin. And if you get an infection and that infection infects down, causes your mesh to get infected, that becomes a terrible, terrible problem for our patients. And so these are all kind of technical considerations, right? Like you were saying, right? But the background behind that is that like the minimally invasive approaches gives us these big advantages. And the robotic minimally invasive approach provides better repairs in combination with those advantages. So that's what I see. And I've been doing complex abdominal hernia surgery now for almost 6, 7 years, and I will say that the results are remarkable. Results are remarkable. I definitely think that our patients are getting better results, and I'm very proud of the work that we do, right?
Hmm.
And it's very rewarding to do what I do, and
Yeah.
it's very lucky. I feel very lucky to be able to do what I do.
To be a surgeon or to be a doctor is demanding profession.
For
Uh,
sure.
yeah, especially with added complexity of robotic system or complexity from the field in general, you know. And I would like to if you have a chance to share with me, how can you manage the stress and long hours at work?
Yes, I do work a lot, right?
Mm-hmm.
And yes, it is a big time commitment, right?
Mm-hmm.
But I think that the important at the same time, right? I don't work at all, right? Because I love what I do, right? And so I I um, I don't think that a person, right, can do the things that I do in the with the time commitment and the hours that I do unless you happen to love what you do, right? Because otherwise you will be unhappy. Does that make sense? And it's not very sustainable, right? And so I have the good fortune, and it's just a luck more than anything else that I love my work, right? And so I don't think it's for everyone, right? And you might say, "Oh man, he's working so." My wife says, "Oh my God, it's so bad. He's working so much." What she doesn't know is that I know I'm not really working that much. I'm playing at work all the time. I love what I do, right? And so that helps a lot. So that's the
Mm-hmm.
one thing, right? But you're right in the sense that that time is not replaceable, right? And I do have a family, and I love the time I spend with my family as well. And my career and my job takes me away from them. That's for sure, right?
Yeah.
And that's and the only way that that is possible, right, is because of my wife, right? Because my wife is so understanding, so supportive, and is wonderful with my children, and takes wonderful care of them, right? And she knows um, how how much my my job and my career is how important it is to my happiness as well, right?
Mm.
And so it is so important, right, to have a partner who is supportive in that way, and helps through that. And so that's kind of the trick of it, I guess I would say. I think there's one other thing. There's one other thing, and that is that because you spend that much time, right, in your career, right? When I am at home, right, and I'm the time I spend with my kids is valuable, right? And so I try to make the most of it as much as I can. I don't think everybody should be a surgeon, right? It does take a certain type of person, but everybody should do what they love, right?
Yeah.
And I can,
Yeah.
because if you do what you love, right, and it's meaningful to you in any
Mm-hmm.
way, it won't be work. And so that's
Yeah.
important. Yeah.
This is the point. This is the key of the success. If you love something that you're gonna do or you are doing, you're gonna be successful, even though the challenges on your life is something like that. Dr. Ken, I'm so happy that I know you and your family too,
Oh,
especially your
yes.
family too. I'm so close with
Right.
them. And I know really, really good your relationship and your time then you spend with them. and what they do for you also. They understand you a lot, even though you spend too much time for your career and for your job that you loved so much. But maybe you have those kind of moments that you feel stressful.
Um,
And what kind of strategies do you use to ensure you maintain your balance between your career and your personal life, especially
yeah,
spending
yeah,
time with family? Do you have any other hobbies, any other activities?
yeah, yeah. I mean, there are definitely times and when things are stressful. I definitely enjoy, other activities when I can, right?
Mm-hmm.
I enjoy playing tennis. I have a tennis partner that I play with on a fairly regular basis. I like working out as much as I can. But that's sometimes difficult. Um,
Mm-hmm.
and with kids, it's always harder to do some of these things, right? Lately, I've gotten into badminton, which is kind of strange. I don't know how I ended up started doing badminton, but I've been doing badminton a lot. The other thing I also is one of my guilty pleasure hobbies, right, is playing with Legos. And playing with Legos is one of those things where it's just it lets you kind of like separate a little bit
Mm-hmm.
from the world, right? So you can just sit
Yeah.
there, you don't have to think too much. The instructions are right there. You just follow the instructions. And at the end, you get this wonderful little creation.
Mm-hmm.
And granted, okay, you didn't make it up yourself, and you could kind of make things up yourself too if you wanted to. But I really enjoy putting together Legos, and I do it with my kids too. Sometimes
Mm-hmm.
when we have Legos, we did them together over during the COVID
Yeah.
destruction of a spring break, we had this big Lego set, and that, like, I was like, oh, well, since we can't go on our, planned
Yeah.
vacation, myself and my two kids, we basically set up this giant Lego set and put it together over the course of over a month. It was like the giant Millennium Falcon. It was very fun for them.
Mm-hmm.
Then I love watching movies, believe it or not. I have a lot of, it's one of those things that I really enjoy doing. And so movies and a few television shows.
I know that you are so busy because we planned this interview a month before, and I'm so happy that
Yeah,
we had a chance to realize together.
yeah,
And
yeah.
I'm
It's
not gonna
wonderful to talk to
talk,
you.
yeah, I'm not gonna take much more time from you.
That's
So I'm
okay. It's
just,
okay. This time is yours. I want to be able to share my time with you, and you share
yeah,
in your audience, and if they have
mm,
any questions.
yeah. Thank you so much for your time and being my guest on my podcast.
I feel like privileged to be one
Mhm.
of your guests.
Thank you so much. Thank you so much.